Hi there, Care Prevention, and welcome to our talk on cervical spine injury. And I want to begin this talk by reminding you that we are speaking about injuries that cause or have the potential to cause sudden death in sports. And so cervical spine injury is one of the most rare occurrences in sporting events. Now, while I say that, we have a lot of sports that occur on a weekly basis that could incur a cervical spine injury, but by far and above any other in the United States is the sport of football. And so what we know from the textbook is that if you do the math on the statistics that was presented, we're likely to see between 9 and 10 cervical spine injuries per year, just based off of the amount of athletes that participate in the sport of football. And that goes from Pee Wee all the way up to the National Football League. And so there is a lot of participants, and with that high number of participants, we can still see, even one would be too many, but we can still see up to 10 per year with the statistics that we're finding on that. And I personally have only known and met two athletes ever who have sustained a cervical spine injury from participating in football. One of those was Kevin Everett, who played for the Buffalo Bills, and his story is down below here. And I did meet him, and he was a success story because of early interventions that were made on his behalf on the field in his early care to prevent spinal cord swelling. So it's an amazing story. I hope you watch that and see that. But we want to begin this by talking about what happens at the spinal cord. You have 7 cervical vertebrae, and these are the bones that surround your spinal cord in your neck. And what happens is, what we've learned over the years is that a person will lower their head, and when they lower their head to tackle, they actually straighten what used to be a curved cervical spine. And when they do that, then they take an impact on the top of their head, and that is called axial loading. Now, axial loading is a mechanism that happens anytime you look at a bone or a series of bones that rotate around an axis, which your vertebrae do, right? And so when they flex forward, they flatten and straighten, and then the impact comes on top of the head, and when that happens, that axial load occurs, and that axial load can result in one of two things, could result in one of those two things: fracture or dislocation of the vertebrae. And so that trauma immediately affects the spinal cord at a very high level. And this is where the term quadriplegia comes from, is a cervical spine injury that results in long-term disability and changing quality of life, and in some cases even death if that injury is high enough. And so that fracture or dislocation that occurs happens because we have lowered our head. We've allowed that axial load to compress those vertebrae to an extent that causes a substantial injury. So my next thing here is stinger. And so what I want to do is I want to say, okay, so we've had an athlete on the field, and from our concussion videos, we remember that an athlete who is lying motionless on the field is the most scary thing. If they've lost consciousness, or if, even worse, they're lying there and they are conscious, but they're unable to move. And so when you approach that athlete, some of the things that you're going to ask, even in your primary survey, after you've done your airway, your breathing, and your circulation, is then you're going to perform a series of questions about if they have neck pain. And if they have neck pain, you're going to ask, do you have any numbness or tingling, especially in your arms and into your legs? Can you feel your arms? Can you feel your legs? And then once I've identified that, the unfortunate reality is that most people fall forward onto their belly. And so it's very difficult for you to get information about whether they can move their lower extremities and their hands. But if you can get them when they have gotten to their back, and hopefully they did that on their own. But sometimes we have to get them to their back. And so what I will tell you is if they're lying motionless, the first thing you're going to do is you're going to stabilize the head. And there's a video that shows this down below. But you're going to stabilize that head. And when you stabilize that head, you have to do it in such a way that you're prepared if they are laying on their stomach to rotate them over. And so you're going to stabilize their head using a reversal pattern on your grip. And that way you anticipate rolling them in the event that you have to. So this is for face down. So the rule is if they're face down, you reverse your grip and anticipate that you're going to roll them over. Now you're going to do this with several people. You're not going to do this on your own. And so it's important that you have practiced this in your emergency action plan. And remember that from several modules ago, we discussed an emergency action plan. And so your emergency action plan should have an emergency action team that has prepared for an event like this. So if you're coaching football or you're coaching basketball, either one, you should have an emergency action plan with an emergency action team who is prepared to log roll a patient or a potential cervical spine injury over, and then also loading them on this thing right here called a spine board. Now, most of the time, you're going to enact the EMS system, and they're going to come in and they're going to take care of a lot of this for you. But you need to be prepared to help out. A great example of this is having a football player or even a basketball player who weighs in the upper 200 pounds and is 6 foot tall, and you have a couple of EMS people who in no way can handle that on their own. And so your team needs to be able to come in and participate in the log roll as well as the loading of the athlete. But again, you're going to see that in the video down below. Next, let's talk about this stinger. How do you know when an athlete comes in? And if you'll remember back in the shoulder, we talked about stingers. How do you know if an athlete comes in and they just or you find that athlete on the field and they say it's numb and it's tingly down one arm? Well, my thing is if it's numb and tingly down one arm and they got up and ran to you, that's probably a stinger. But if they're still on the field and they're motionless and they're complaining about numbness and tingling, even if it is just down one arm, you don't default and say, well, it's probably a stinger, let's set up and let's see how this gets. You default to, this could be a cervical spine injury, and we're going to make sure this person is taken care of. And so I'm going to stabilize the head, and I'm going to keep them right here. We're going to call EMS, and we're going to get this spine board out on the field, and we're going to get them off. That is always a question that comes up as, well, what if they do just have a stinger? You know what? If they do and they miss a little bit of time in the game, that stinks, but that's better than you mishandling a potential cervical spine injury because your liability insurance cannot handle a potential legal action against you because you mishandled a cervical spine injury. So on page 157, how do we handle a cervical spine injury? There's a wonderful set of guidelines there, and you're going to see a lot of questions in the quiz about this, but there's some key things that you want to look at here. And first of all is, what equipment can you take off? Well, the only thing you can take off of a football athlete safely is the face mask. Now, the question is how does that face mask come off? Some face masks require a Phillips head screwdriver to take off. Some of them have these little plastic clips that if you have the right tool, you can take them off. It's like a pair of gardening shears. And then some face masks have a push button release on the clips that you have to have a kind of a narrow tool to just go in there and push in, and it releases the clip and you can pull the face mask off. So what's important about the face mask? Well, the face mask may need to come off in the event that they have some type of respiratory distress that occurs from a high spinal cord fracture. See cervical spine 1, 2, and 3 are very well known for this because the C3, C4, and C5 nerve roots go down and they innervate at the diaphragm, and so anything that happens above that could shut those down. And I would tell you that if you have a cervical 1 fracture, they're pretty unstable, and it's very unlikely that that person's going to live, and so you have to take care of them very quickly and getting that face mask off and getting them ready for intubation because they're not going to be able to breathe on their own. So we have to think about how that's going to act, because as the spinal cord works, it loses everything down from the fracture. And so you look at that and you say if they have a C1, C2, C3, C4, C5, they're going to have respiratory distress. And so it's important that we get that face mask off so we can get breathing help to them as quickly as we can. The next thing is our helmet. We never take a helmet off. We always leave that helmet on. The face mask can come off, but the helmet needs to stay on. Because if you've ever had a football helmet on just for fun, or you played, you know that comes off and it does a lot of stress on those neck muscles to get it off. And so we don't take a helmet off. There is a method for taking it off once they get to the hospital, but we're going to let the hospital do that. What we're going to do is we're going to leave it on. And we're going to use the helmet with the shoulder pads to keep that neck in line. Now, if for some reason the shoulder pads were to come off, the helmet would have to come off too, because now you have a head and a torso that will be imbalanced because of the equipment. Same thing, if you take the helmet off or somehow got the helmet off, you would need to remove the shoulder pads as well. And so that's just kind of one of the things out there, but we don't take any equipment off. We're going to leave it on except for the face mask. Another thing here comes in is chin straps. I've literally had an EMS person come in and attempt to cut the chin strap off after we've stabilized the C-spine. And I had to stop them and say, don't do that, because the chin strap plays an integral role with that helmet in keeping the head stable. And so we've talked about how to keep the head stable. We talked about how to prepare ourselves if that person is laying on their stomach to anticipate the log roll. But we also have to think about what equipment can we take off, and that's very little. I hope that you've learned something in this video as well. I hope that you enjoy the videos to follow. Make sure you're writing a bullet point, 3 bullet points for each video as you see them come up. If you have any questions, please make sure you email me. See you soon.